The Auditor-General provides assurance to Parliament on the accountability and performance of the Victorian public sector. The Auditor-General conducts financial audits and performance audits and reports on the results of these audits to Parliament. On the 26th of March 2014, the Auditor-General tabled his performance audit report, Residential Care Services for Children. On any given day, there are around 500 children in residential care in Victoria. This is only a small number of children, but they are the most vulnerable children in the state and are generally not suited to other types of home-based care. Children are placed in the care of the state usually because they have suffered severe abuse or neglect in their family homes or are at risk of being exposed to this. Children in residential care live in a house or unit with a small number of other children from similarly traumatic situations under the 24-hour care of paid staff. They are usually between 12 and 17 years old, although there are some children younger than 12 in the system. These children have experienced traumatic circumstances and as a result can engage in very challenging behaviour, including violence, aggression, self-harm, drug and alcohol abuse, sexualised behaviour, absconding from care, emotional disturbance, learning disorders, and difficulty forming attachments. Managing the residential care system is the responsibility of the Department of Human Services, hereafter referred to as the Department. To give a snapshot of children in residential care, on the 30th of June 2013, there were 504 children in residential care. 211 were girls and 293 were boys. The average age was 14, 65 of the children were under 12, the average age when first placed in out-of-home care was 9 years old, and almost half were placed with at least one sibling. There are two main types of care: home-based, which includes kinship and foster care, and residential care. The Department's preferred option is kinship, then foster care, which offer family-like settings. Residential care is the most expensive of the out-of-home care options. There are two types of residential care: standard and therapeutic care. The audit examined the effectiveness of the Department's residential care services for children. In particular, we looked at whether children are in appropriate residential care that meets their needs, including safety, stability, and personal development, whether the residential care system is subject to effective oversight and review, and whether the Department supports service providers to meet the needs of young people in care. The audit focused on the Department's planning, monitoring, and oversight activities for residential care services. It did not look at kinship or foster care. We collected evidence from a range of sources, including departmental documents, interviews, focus group discussions, site visits, and case file reviews. Based on this evidence, we concluded that the system is unable to respond to the level of demand or the growing complexity of children's needs. The Department is paying a premium to place children in residential care outside the planned capacity of the system. Outcomes for children in residential care are poor across a range of indicators, including education, health, connection to family and culture, and independent living skills after leaving care. These conclusions were based on several key findings. The system is operating over capacity, which means the Department needs to fund additional beds and pay more to service providers for staff time and other costs. In 2012-13, the Department planned for 459 residential care placements. However, there was an average of 508 children in residential care on any given day. The number of children in residential care has grown over the past 10 years. Their needs are becoming increasingly complex and they are staying longer in residential care. These trends have placed considerable pressure on the system. The costs of residential care services are very high, at over $100 million per year. In 2013-14, the annual cost of a placement ranges from $162,880 for an intermediate placement, which is a standard placement, to $308,028 for a complex therapeutic placement. Some placements for children with highly complex needs can cost up to $1 million. The system needs some flexibility because if a child is at risk of harm, the Department must act immediately to protect that child, irrespective of whether the placement has been planned or budgeted for. The consequence of this is that unplanned capacity usually costs more and results in poorer outcomes. In 2012-13, the Department purchased additional placements at a cost of $24 million. In 2011-12, this additional cost was around $19 million. Of that $19 million, $11.3 million came from other programs earmarked for departmental funding. The department does not systematically monitor outcomes for the whole residential care population. Without this, it is difficult to identify trends in children's health. Service providers only have to report on outputs, like the number of placements, not on outcomes, such as whether children are healthy or attending and engaging in school. We also found that not all residential care staff are adequately trained and skilled. Staff do not need formal qualifications to work in residential care services, yet they need to care for children with complex needs, including violent and risk-taking behaviours, substance abuse and mental health issues. Casual staff make up around 55% of the residential care workforce, and there is also a high turnover of staff, which makes it difficult for children to develop trusted relationships with their carers. Children's needs are not always being met. The shortage of placements means that decisions are often based on bed availability rather than on making sure that a child's needs and behaviour are compatible with those of other children in a residential home. For example, if you put a vulnerable younger child into a unit with older children who are taking drugs or drinking excessively, then the child can be affected by this exposure. If you put a child who has been sexually abused with another child who displays sexualised behaviour, then you are potentially putting both children at risk. Poor placement decision-making can affect a child's safety and stability and reduce opportunities to achieve other positive outcomes. We found children's outcomes in education, health, and preparation for living independently after leaving care were poor. The number of critical incidents, such as client death or severe trauma, is disproportionately high for children in residential care compared with children in other forms of out-of-home care. This graph shows the number of critical incidents in residential care over the previous 4 years, which is the dark blue line, and the percentage of all critical incidents in out-of-home care that happened in residential care, which is the light blue line. Despite making up only around 10% of out-of-home care placements, residential care has accounted for over 40% of the critical incidents over the 4 years. We found that children in therapeutic residential care have better outcomes than children in the standard model of care. This is partly because staff have access to a therapeutic specialist who can help build skills and confidence in managing challenging situations, and partly because placement is planned, which enables children to be carefully placed with other children. This reduces the risk of conflict in the residential home or exposure to inappropriate behaviours. Finally, we found that children need an independent advocate. They often do not have families who can advocate for them. They do not always know about complaints-making processes, and while there are independent organisations who can investigate system complaints, currently there is no organisation that can advocate for individual children. We made 6 recommendations to the department aimed at strengthening the system, improving the quality of service provision, and meeting the needs of children in residential care. These have all been accepted by the department. We will be following up on the recommendations made in this report. A past audit in this area was the 2005 Our Children Are Our Future audit, which assessed the Department of Human Services' implementation of reforms to out-of-home care. This report and all other reports are available on our website. If you have any questions about this or other reports, or if you have anything else you would like to discuss with us, including ideas for future audit topics, please call us on 03 8601 7000 or contact us via our website.